Alrighty, so here are some of the exercises that I would do with my patient who had a supracondylar fracture. He would be in a splint until about 6 weeks or after, and so these exercises should be started around that time, if not sooner, to increase mobilization and decrease the effects of immobilization and get strength and range of motion back as quickly as possible. But these exercises should be done in the pain-free motion, and they should not aggravate, do anything that aggravates their symptoms. And so here are some exercises that I would do with them. So first of all, I would just do elbow bend to straighten is what they're called. And so do elbow bend to straighten, okay? And do these about 10 times with no increase of symptoms. And then I would have them seated with their forearm, just kind of lightly resting or at this position, and they will do forearm rotations to increase that pronation and supination, just getting that gentle stretch within the elbow and the forearm. And then you can do like with a ball or a ball of socks, we would just grip it with their fist to increase grip strength and release. Do it 10 times to increase the strength of those forearm muscles. And all these exercises should not be done to pain. And then next, we will do just some range of motion exercises. So just with their elbow resting just over the table, and we will just have it go straight and then come up, and so you can work into flexion. And then if you want to scoot to the edge of the table so your arm just hangs off, and then they will work on extension exercises, just gently. So active, flexion, and extension, just working on getting that range of motion back. And then they can work on also a tricep stretch, which is just pulling your arm overhead and pulling with your opposite arm there. So that's stretching those triceps, as well as if you stand up and turn around, you can put your arms on the table and then do a bicep stretch. So just backwards and stretching out the biceps. And so these are just some simple exercises that they can do at home to increase the range of motion, working on stretching and strengthening of those muscles.